anesthetic machine. This is Dr. Sharma, who is our anesthetist. This is a fantastic Volison machine with which we can do a very good visualization and pickup. The anesthesia that we give is with propofol, and it's a version of total intravenous anesthesia. And so it's very quick in and quick out. Earlier it was done, transvaginal oocyte aspiration was done under sedation and local block, and it was very, very difficult for the patient as well as the doctor to conduct the process. General anesthesia has its risks and complications, and therefore with the advent of propofol, egg pickup has become almost like a breeze. Now once we have seen the OT, I would like you to have a quick glimpse of our embryology lab. Of an ovum pickup. We are using this needle. There are various needles in the market. It's a Cook needle, 17 gauge, 35 centimeter.
Single lumen.
Single lumen.
Yeah.
And this is attached to the tube. And from the tube there is another connection that is going to the suction machine. This suction machine is operated by a foot pump that I will be using with my left leg. Now I shall demonstrate to you. Poonam will be setting the transvaginal probe. So just see how the setup of the probe is done.
So Dr. Kaberi, can you hear me?
Yes.
Okay, fine. So I can see you are lefty. You use your left leg.
No, only my left leg, but I'm a right-handed. So if you see the probe cover, it's completely non-spermicidal, and special probe covers available for oocyte pickup. And there are various ways to cover your probe. Sometimes disposable guides are available. We are using autoclaved metallic guides. There's a sterile cloth that's tied. You can have a sterile cover that's running from top to the machine. And then we will be sticking the metallic probe.
The metallic probes have a little tricky adjustments.
Yes. You have to have a probe that is fitting your machine, and the adjustments has to be absolutely perfect for a good grip.
Yeah.
Otherwise you may...
They will not just close down.
Absolutely. So now the probe is kept back in the machine, and I'll just demonstrate the cleaning and washing of the patient. As we all know, we are only using saline and not any other antiseptic solution. There are various ways of doing it. Can I have the head down of the patient slightly, please? It's always best to put the patient in head down. You want to keep your guts away.
Can we have the OT light close? I mean to say the other ones, apart from the, I think it's better now. Yeah.
So thorough washing and cleaning with normal saline is what we would prefer.
Yeah, we can see you douching the cavity. It's fine. Dr. Kaberi, Dr. Parul this side. Our
Hello,
audience
Parul.
wants to know that at what day of the cycle, which day you are doing this pickup? This is 14th or 16th or what day?
Right. This is one of our donors for stimulation. She's been stimulated by an antagonist protocol. And can we have the camera on the machine, please? You nikal do your camera.
See, we can see the ultrasound monitor.
So she was started. I do a lot of my cycles, almost 90% of my cycles as antagonist protocol. So the stimulation was started with HMG on day 2. I started with 300 units, and today is day 14 of her cycle. So trigger was given on the 12th day of the cycle, and we are now doing the ovum pickup.
Fine.
Till I don't say the camera, please do not put the other camera on. Please put off this camera. Can I have it switched off, please? Please put it on only when I indicate, for sake of patient privacy.
So here we can see the follicles.
So you can see the image. This is the right ovary, and this is the left ovary. Now you can isko cover kar do. Just I want to show the probe, only the probe. Right. Can I have the camera on? Okay. So the probe has been inserted, and then the needle. We typically check before we start. So if you can follow my needle with the other camera.
No.
Can I have a camera here on my needle? On my needle, please. Can people see?
We can see you flushing.
Okay, yeah. So this is just to check that
the needle is functioning properly or not.
Yes.
Yeah.
Now please focus. Right. So let us have the ultrasound image as the major thing and a PIP. Okay. Can I have the screen towards me slightly? Right. So the needle goes into the follicle and my suction machine is on. My foot is on the machine, and you need to follow the tip of your needle and then gently take it out so that you're sure you have covered the entire follicle before withdrawing. Yes, please keep on changing as the tube gets filling. I go to the other follicle. In between the follicles, it's always good to release a little bit of the pressure. Yeah, please change as it's filling. There's no need to ask every time. So I have given instruction to my team to change the tube when
it's filled almost, huh? At what time you would like to, Dr. Kaberi, doctor wants to know what is the suction pressure you're keeping right now?